Okay.
Good evening, everybody. Happy Wednesday, Fulton County School System employees. I hope that you are doing well this evening. We are super excited about our final session in our three-part series. We have two amazing physicians again that are prepared to answer all of your questions that you've submitted and those that were left over from Monday's event. So we already have them logged. We're ready to go. So with that being said, remember today's session is entitled Realities of Next Steps, the Path Forward. And both of our presenters will have an opportunity at the very end to talk a little bit about what we can expect going forward. But tonight's session is really to have an opportunity to get those questions answered that you still have. We will have an opportunity for you to continue to put your questions in the chat. We'll try to get to as many of those as well, but we already do have our list. So we'll go ahead and jump right on in tonight's session. Again, we have two amazing presenters tonight, or our experts in this COVID world and space. One is, again, no stranger to you all. It's Dr. Yolanda Wimberly. You were introduced to Dr. Wimberly on Monday. Dr. Wimberly, again, is our medical director. She is by title the Senior Associate Dean of Clinical Affairs at Morehouse School of Medicine and at Grady, where she leads the clinical enterprise for Morehouse School of Medicine. She is a pediatrician. She's renowned in adolescent health. She, as I said on Monday, is just a great addition to our team here in Fulton County. She does serve as our medical director in Fulton County. We're so fortunate to have Dr. Wimberly, and on Monday she got glowing remarks for all of her awesome responses with she and Dr. Manning. We also have tonight joining her, and again, no stranger to Fulton County employees, Dr. David Holland. Dr. David Holland is my favorite physician from Fulton County Board of Health. He is the Chief Clinical Officer for Medical and Preventive Services for Fulton County Board of Health. He and Dr. Paxton lead, obviously, Fulton County Board of Health initiative. They're leading their vaccination initiative. Dr. Holland is probably, outside of the folks that work at Mercedes-Benz Stadium, been there the most at Mercedes-Benz Stadium. So we are super excited to have Dr. Holland. He is also an assistant professor at Emory in the School of Medicine. He has specialties his specialty actually is in infectious diseases and internal medicine. So we are in good hands this evening. So with that being said, I'm going to just turn it over real quickly to both Dr. Wimberly and Dr. Holland just for some opening remarks if they have any, and then we're going to get right to the question. So I'll turn it over first to Dr. Wimberly and then followed by Dr. Holland.
Thank you so much. And I'm glad to be here with you all this afternoon. At this time, definitely want to make sure that you're able to ask all the questions that you have. No question should go unanswered tonight. So we're definitely looking forward to being able to help to educate you in some areas where you may need a little bit more information, and also maybe to confirm some ideas or some information that you've already heard. I'm hopeful that a lot of you have already started on your pathway to signing up to get vaccinated. It's very exciting at this particular point in time for you to be offered that opportunity that a lot of people out there that we see in our community are wanting. So just want to be here and be of service to you and be a resource. So happy to be here this afternoon.
And I too want to thank you, Ms. Meadows, for inviting me. Vaccinations are, and I mean, ever since they were first invented, they've always been our best and easiest and safest way out of any kind of disease process that's infectious. And you know, we've been a couple of weeks ago, we celebrated the 1 year celebrated the 1 year anniversary of COVID appearing in Georgia and in Fulton County. And we have the vaccine now, which is our way out. It is the way to put this all to rest. And we, at the Board of Health, we definitely want to make everybody feel very safe, very comfortable about getting this vaccine. And as Dr. Wimberly said, answer every question. And if I can't answer a question tonight, I will be sure to research it and get back to you, because I do not want to leave any question unanswered.
Awesome. Thank you so much. So again, we'll just dive right in. So the very first question, and this keeps coming up, Dr. Wimberly. So this is something that you're going to hear that you heard on Monday, but today we've got a lot of questions, this same question. How much time should you wait to receive the vaccine after you've tested positive and you're out of quarantine?
Right. Okay. So, and Dr. Holland, I'll give my answer. And if you can back me up with what your official policy is at the county, that would be great. So initially, when this first came out by the CDC, they had recommended 90 days. The reason that 90 days was recommended was really because of the supply. So it wasn't on data. It was really on the fact that if you had been infected with COVID, it was thought that your immunity would be good at least for 90 days. And so therefore, as the supply of the vaccine was coming in, those folks who had been COVID positive would be prioritized a little bit differently than those folks who had never ever been vaccinated and or had contracted COVID-19. And so that was really the whole basis for the 90 days. Now that the vaccine supply is there more, there have been conversations about, is that 90-day rule still going to be in place as far as having to wait 90 days since the last time that you were COVID positive. I'll let Dr. Holland say what their plan is at this point in time. We have been getting this question a lot, Dr. Holland. So if they had, what is the minimum amount of time since they have recovered from COVID-19 to when they can actually be eligible for the vaccine?
Yeah, so your answer was spot on, and the current guidance that we are following is as soon as you've recovered. Okay. And by recovered, we want 10 days from the test, so out of the quarantine period, or it's not a quarantine, but out of the isolation period, and that you're feeling better. Okay. And the reason is that we don't want to confuse, it's totally safe, but we just don't want to confuse symptoms of COVID with, reactions from a vaccine. So it's just, we want you feeling good when you get your vaccine, and that's it. So day 10, come on in.
Awesome. And that leads us to one question that was just asked as well. Can you still get the vaccine if you don't feel well? So nothing about you've tested positive for COVID, but you wake up, it's your day to get the vaccine and you don't feel well.
Well, technically we would advise you to wait. However, just today at the stadium, somebody came in and they had symptoms of bronchitis, and they had waited a while because we were a little overbooked today, and so we gave them the vaccine, and we advised them that it was probably not the best practice, but again, it's totally safe. We just don't want to confuse a vaccine reaction from people being sick, and that's really it. There's no reason for that it would be dangerous in any way.
Yeah, and I get that question. I get people texting me at like 10 o'clock at night saying, so-and-so's sick, can they go get their vaccine tomorrow? And it just depends on what you mean by sick, I mean, definitely if you have a fever, or something like that, you might want to stay away. But if it's something where you may be having sinus congestion or things of that nature, and you're pretty much, socially distancing, wearing your mask anyway, each person has to really take that into consideration. So I tell people, if you don't have a fever, which if you have a fever, you probably shouldn't be going anywhere, to be contagious for anyone else. But outside of that, those are really symptoms that I look for. Do you have a fever at that particular point in time for me? And like Dr. Holland said, and a lot of it really is just to not confuse if something were to happen. But that's one of the main reasons.
And another question that came back up today that's, I know you addressed it to some extent, you and Dr. Manning, on Monday, but just reiterate this question, which has to do with if an individual has several drug allergies, what about reactions? Should they be concerned about a reaction? What can they expect? And knowing their history, talk a little bit about drug allergies.
Yeah, that's a very good question, because this is one of the things that everybody's concerned about. So there have been, a very small number, actually, for the Pfizer vaccine, that is the one that we use. It's 5 cases per 1 million doses of a, significant allergic reaction to the vaccine. And, like almost everybody gets a little bit of pain in their arm, and some people get, some fever and everything. That's how you know the vaccine is working, by the way. But there's, these serious reactions. It's 5 per 1 million doses. But almost all of them occur in people that have had severe allergic reactions to something else. It could have been a bee sting or a medication or a vaccine or something like that. But these are severe reactions, things that put you in the hospital where they had to give you an EpiPen, that kind of thing. A rash or hives or something like that. That is not one of the things that predisposes you to these reactions. So, but even if you've had a severe allergic reaction to a drug in the past, the vaccine reactions are still very, very rare. All we do is we recommend that you stay and get monitored a little bit longer so that we can just be sure you're safe. And I need to absolutely emphasize, nobody, and I don't care what you've heard, nobody has died from getting one of these vaccines. Nobody. Even the very, very severe reactions, nobody has died. So even then, they're still very safe.
And we've given out thousands of these as well at Grady, and we really have not had any severe allergic reactions. And remember that we have medications there, so we have EpiPens, we have things there. So if that happens, and there's typically at a lot of these sites, there's somebody that's present, either a mid-level or a physician that's there to be able to handle that. So, so even if something were to happen, we have first aid kits and tackle boxes that, the nurses and the docs, we know how to do this. So we're prepared if that does happen.
Yeah, and if you come to the stadium for your vaccine, we've got paramedics on site, doctors, nurses.
Yep.
You're going to be fine. And you're like 0.4 miles from Grady, so.
And that was a question too, Lynn, that was on the Survey Monkey that we answered. So that was all the questions off the Survey Monkey so far.
Awesome.
And I'll add too, we've given out over 100,000 vaccines and haven't had any.
Awesome. Thank you for that. And thank you so much, both of you all, for adding the fact that we're going to be well equipped and well versed in terms of staffing at the Mercedes-Benz Stadium should something happen. To your point, we'll have medical teams there. Dr. Wimberly is going to be on site. Typically, Dr. Holland is on site, but nonetheless, there'll be paramedics. And as Dr. Holland said, the most important thing is we have medications and supplies in the event that something happens, not just the personnel, but the supplies on hand as well. So the next question that also, again, is just an extension of something that we talked about on Monday is pregnancy. And the question has to do with, is there any information on the vaccine and pregnancy as it relates to newborns? Are newborns somewhat protected once they're born if a pregnant mom gets vaccinated?
That is a great question, because this is hot off the press.
Yeah.
Yeah. So first of all, I just want to say, they did exclude pregnant women from the studies. However, the CDC notes that people that get COVID while they're pregnant can have severe complications. So they advise us to offer the vaccine to people who are pregnant. And in all of the women who have registered on the CDC's VSafe monitoring system that were pregnant, there have been no cases of any kind of problems. But the first baby, or I don't know if it's the first baby, but one of the first babies that was born to a woman that got the COVID vaccine, was recently born, and they tested the baby, and the baby has antibodies to COVID from the mother. So, you know, when women are giving birth or when they're pregnant, the mom can give antibodies to the baby to protect them. And it turns out that there is placental transfer of the antibodies. So the babies are born with some protection against COVID. So that's a good thing.
Mm-hmm. Yeah, and as always too, we ask all pregnant women to definitely consult your physician and have a conversation with your OBGYN. But there is no contraindication that states that pregnant women cannot receive it, and we've given it to lots of pregnant women as well, and have not had any adverse side effects or events, and that includes lactating too. Just to throw that on in there, lactating women as well.
And so while we're talking about special groups and special considerations, can you also address the safety of the vaccine for those who have autoimmune diseases, things like lupus?
There's no contraindication and no suggestion of any additional safety issues in people with autoimmune disorders.
Yeah, it's safe for them to take the vaccine.
Awesome.
And probably advised, especially if you're going to take immune suppressants to treat the disease.
Yeah.
Thank you for that response. Now, this is more of a technical question with regards to the vaccine and the vaccine properties. So the question has to do, and I know Dr. Wimberly, you all did an excellent job at talking about how the vaccine was developed. So the question is to explain again the difference between the viral vector technology and how the two different vaccines were developed, meaning the Pfizer vaccine and Moderna versus the Johnson & Johnson vaccine.
Okay, so the Pfizer and Moderna were developed off of a technology called mRNA, and that's a newer technology that has been being developed since actually 2014. And so while people think that it's something that is new, it actually is not something that's new. The technology has been researched and being developed since 2014. This is one of the probably more widely spread vaccines that it has been used in, but the mRNA technology takes it and works off of what we call a spike protein, and so it gets your body primed to make antibodies against a spike protein. The viral vector, which is the Johnson & Johnson vaccine, which is the one-dose vaccine, has the viral vector technology, which means that they use a shell. So they take an adenovirus and they take the virus out and use that shell as a vector to be able to introduce the technology into the body, which then has your body to produce antibodies to the coronavirus. And so those are the two technologies, the mRNA and also which is the newer technology, and then the viral vector, which is a technology that we've been using for quite a while in a lot of other vaccines. And so those are the two differences between those vaccines. There is no introduction of the coronavirus vaccine into you so that you will get sick and contagious and pass it on to someone else. That is not true. Neither one of these technologies uses any type of live or dead coronavirus that introduces it into your body. So it's important for you to really understand that. And to also know, just as I said, the mRNA technology is a newer technology than the viral vector technology, but it's something that has been being researched since 2014.
Awesome. So the next question has to do with a vaccine that we don't have here in the United States, but I guess someone is curious about it, which is the Astrazeneca virus. And they wanted to know what happened to that and why is that not a vaccine that's available in the United States right now?
It hasn't been, the research hasn't been completed on it yet here. So it's been studied in the United Kingdom, but in order to test stuff, in order to submit stuff for approval in the United States, even emergency approval, you have to do the studies here, and those have not been completed yet.
Awesome. So this is another technical question. So we know that the vaccine now is available to several groups. At one time, we were talking about phase A, phase 1A and phase 1B and all of those. We've gotten away from that to really talking more about who's eligible and the timing of eligibility. So can you talk about, just give kind of a quick update on who is currently eligible for the vaccine as it stands?
Absolutely. So, yeah, so we did have this, so the real thing about first of all, the thing about eligibility is about, if we had enough vaccine and enough people, the Board of Health would go out and vaccinate everybody tomorrow and just be done with it, right? But we don't. We just don't. The vaccine was, we just had a little bit, and we're getting more and more and more, and they're ramping up production, and new vaccines are being approved. So now we have 3 vaccines, and so there's a lot more vaccine. So it's not a matter of like moving through each group. It's just, we add people in as we get enough vaccine to add in groups. And so we did have these phases, and I'm not, I'm actually kind of, one of the things I actually do agree with the governor on, this idea of like not doing these phases, because that was getting confusing. We just add people, say, add groups, like you said. And so here's the current groups. Well, it started with healthcare workers, frontline responders, public safety, and then let's see. God, this is such a long list now. Let me give you a better way to think about this is who's not eligible. Okay. So
that's what I was going to say.
Because one of the eligibility criteria is a BMI of greater than 25. Now, this is about 75%. They call it overweight, but don't listen to that because that's nuts. Because BMI is a terrible thing. So that's about 75% of the citizens of Georgia qualify under that. But it's healthcare workers, frontline responders, teachers, law enforcement, that group, people with certain chronic medical conditions, including people with a BMI over 25, and they added in the court system yesterday. But honestly, right now, so many people qualify, it's almost not even worth thinking about that. And I would just, be honest, we're not weighing people or, taking their medical history when they come in. So we just want people to get vaccinated.
Yeah, I think the only group that I want to bring up is people under the age of 16. But even you have 16 and older who fall into pretty much any category. They're 16 and older, they can get it. And Moderna just did release something, I think on yesterday, or maybe it was this morning. These days are all blending together. That stated that the trials that they were having on their 6-month-olds and up, that the data was set to be released this summer. And I think as far as definitely for this constituent group, Pfizer as well as Moderna have done trials on 12 to 17-year-olds to see what those side effects are, if any, there are any adverse effects of the vaccine. And it's hopeful that that those trials will be completed actually by June. So it is thought that even in some of the high school kids, and maybe depending on the age of some of the middle school kids, if they were 12 and older, that there is a possibility that we may be able to add them to the list once approved by the fall. So that's another good sign.
Mm-hmm.
Awesome. And so speaking of that, and along those same lines, one of the questions had to do with, for instance, if I am a teacher and I have a student, or if I'm just an individual period, and I have a student potentially or a child that say might be a young adult that's autistic, is there a certain facility or place in particular? And I know that probably we can only answer this question from a perspective of what's available in Fulton County. But is there, Dr. Holland, you think, and Dr. Wimberly, a one site or somewhere within Fulton County that accommodates individuals with that need special attention?
Mm-hmm. So in Fulton County, we try to refer anybody with any kind of mobility or any kind of special needs to our Georgia International Convention Center site in College Park. It is much more accessible in general, but also it's quieter and so forth. We actually are working with CHOA because what we really want to do is offer a few days where we open early just for the young adults and adults with developmental disabilities and so forth, so that they can come in kind of when it's quiet and there's not so much craziness going on. But we're talking with CHOA about how to make that happen.
That is awesome. So thank you so much. So staying along the same lines of students, there were lots of questions from Monday, Dr. Wimberly, and people applauded you for having said that your two children, your twins, were part of the clinical trials for kids. And so we had several employees, and I had some even on my personal cell phone saying, Lynn, I understand that Dr. Wimberly said her kids are in part of the trial. How can I get, or is there information, or where can I find the information if I wanted to enroll my child in a trial?
You know, it was really interesting how I found the information out. A group asked me to speak about vaccinations in kids, and as part of my research, I did a Google search, and I said they're probably going to ask me about these vaccine trials in kids, and I should know something about it. So I Googled it. I can definitely give you the number because they gave me the number to give out, but I just Googled and found it. It's called the Clinical Researchers of Atlanta, and they have a couple of sites here, and they're doing the Pfizer as well as the Moderna trials. And so that's pretty much, you can Google Clinical Researchers of Atlanta, and I went to the one down in Stockbridge, but they have one up in Roswell. But you know, you can Google, and they're still doing those trials. So that's how I did it. And I'm proud to say that my kids are almost finished, and they've received both doses and did very well. They did very well. So it was definitely, as a parent for me, taking off my doctor hat, as a parent for me, it was definitely something that was a little anxious about. We definitely had a long conversation, my husband and I, and of course the grandparents and the cousins and the aunts got involved as well, to discuss the pros and cons of what that meant, as well as speaking with the kids as well. And once all of that happened, we decided that it was the best thing for our family. But I would encourage those of you who are interested to definitely do a Google search, and I can give the information to Lynn Meadows as well, and just give them a call to see if there's any more availability, and you can really research it on your own to see if it suits your family as well.
Thank you for that information. So the next question is, I've heard that people feel pretty gross after, and I'm using, this is again, I'm just reading the question. I feel pretty gross after the second dose. How long does that usually last? Should I plan to be couch ridden for a day or 2 days or more?
Oh, so much drama over the side effects. You know, I think that the thing is that I think it's, first of all, it's important to remember that the incidence of like anything that's going to really knock you out is actually rare. It's actually not common for that to happen. Again, almost everybody has some pain in their arm, and a few people will feel like a little bit of fatigue and everything. But you know, something that's so bad that is going to knock you down and keep you in bed, that's, first of all, very rare. And when it does happen, it's like a day, maybe 2, for, you know, the people that get that.
Yeah. Yeah, I agree. I had it after, and it's interesting because anecdotally, people will say after the first dose, everything was fine. You have arm soreness. Arm soreness is going to be with any vaccine, not necessarily just related to the COVID, just because of the puncture. The second dose, I'll tell you, I actually, I had just kind of like a couple of cold type symptoms, feeling just a little bit fatigued. You know how you take Benadryl? It kind of felt like that next morning after you take a Benadryl. But other than that, it was fine. I got up, I went to work. I performed all my duties, and our entire office, we all got vaccinated together. All of us came in, and for the most part, everybody kind of said that there was a little bit of congestion and stuff, but nothing that was too harmful. And what I'm seeing in my patients and from folks that we've vaccinated, we really just have not seen anything that has been that significant. Now I was asked the question, should we do the vaccine on a day where we can get the day off? Like some people will say, oh, I want to do it on a Friday just in case, and I have a Saturday. Or some people, depending on if you want to come to work or not, want to do it on a Wednesday, so maybe they can have a long weekend. But I tell people that's your preference. I definitely love having a couch day. So I will tell you that if it is something that you are concerned about, then just do it. Then do it on a Friday or do it on a Thursday. So that, or do it on a Saturday if that's available, if those are things that worry you. Each person reacts differently though, so I would not necessarily go off of what somebody else would happen to someone else, that and saying that will happen to you, because it's not true. But I do notice that people do use that as a guidance. One thing I will say is that it was quite interesting because my fatigue and congestion, I'll tell you, it lasted exactly 12 hours. And after that, it went away. It was like 1 minute it was there, the next minute it wasn't. And as a medical professional, I had to kind of say, okay, is my mind playing tricks on me? But it was really interesting because I felt like a teenager, how they get moody 1 minute, they feel this way. And it was just really neat. So it was very short lived. What I did have was very short lived and was not incapacitating at all.
Mm-hmm. Same.
Great. So now questions about the Johnson & Johnson vaccine, but I want to make it clear to our audience, the vaccine that we will be giving for the Fulton County event is the Pfizer event, in case this is your first time tuning into our session. But this question said, or this person said, participant, what percentage of effectiveness is the Johnson & Johnson vaccine, and do you recommend Johnson & Johnson vaccine for young people due to a more robust immune system?
Mm-hmm. Well, in the study, it was about 66% effective against symptomatic disease. However, it was 100% effective against preventing hospitalizations and death. So, the important thing, and I think this is very important to remember, is that when you have different studies, and in this study, this is this effective, and in this other study, this other drug is some other effectiveness, you cannot compare those directly. These studies were all done in different people at different times in different locations. And so the thing that we can, so saying, this is, comparative efficacy with Pfizer and Moderna, you really can't do that. What you can say is that all three of them are 100% effective in keeping you from dying of COVID after like even one shot. So it's just, they're very good. So and honestly, that's the reason that we care about this infection. I mean, it's because people get very sick. Some people get permanent lung damage if they get the infection, and some people die. And if none of that happened, we wouldn't really care too much. I mean, if it's, like we have lots of viruses that float around that don't kill people and don't make them very sick, and we don't really worry too much about them. So, that's really what we're trying. And of course, we don't want anybody to get sick. We don't want anybody to get anything, but, we're really worried about trying to have people not die. Now, I will also say the other thing about the Johnson & Johnson vaccine is that they presented to the FDA in their filing for approval some data that neither Moderna or Pfizer presented, and Johnson & Johnson presented this data, that it prevents asymptomatic transmission. And the other two probably do that as well. I mean, we have a lot of data that suggests that they do, but they actually presented some data from their clinical trial to say that it actually does this. So there's a lot of reason to have a lot of faith in the Johnson & Johnson vaccine. And the question about who do I recommend it for? I recommend it for anybody. I think everybody should get whichever vaccine they can get first. They're all safe. They're all very effective.
And Dr. Holland, piggybacking on that was a question, can the Johnson & Johnson vaccine be given as a booster later with the other two vaccines since it's a different technology?
No, I would not recommend that. You can, there is one thing, small handful of people that have gotten, had a severe reaction after the first dose of either Pfizer or Moderna should not get either one of those for the second dose. But you can get Johnson & Johnson as a second dose, not as a booster, but as you get one dose of the Johnson & Johnson vaccine and you're done. And so that either way, you've completed your series. There is no data, and there's no reason to believe from an immunology standpoint or anything that getting a Johnson & Johnson vaccine later, having completed a course of the others, will do you any good. There's no reason to believe that it would do you any good. Probably won't hurt you, but no reason to do it.
Okay, thank you for that. So here's some more technical or scenario type questions. So here's one: if an unvaccinated person is the only one in the room of vaccinated individuals, what's the risk to each in comparison?
It depends on who that person is, right? Like where they've been, who they've been. It's like who you've been around, right? If there's somebody, if it's a 25-year-old that's been going out to the bars every Friday and Saturday night, the risk to, I take that back. The risk to actually the people in the room that are vaccinated, pretty low. The vaccines are pretty effective, it's just pretty low.
It is.
Yeah. Yeah, multiple. But then when you're adding people to that, it's really, the question is more about risk to other unvaccinated individuals. But yeah.
So Dr. Holland and Dr. Wimberly, piggybacking on that a little bit, is that if, for instance, an individual is in a room of vaccinated individuals, and say hypothetical, or is there an opportunity for someone who's vaccinated to still maybe have the virus? And what does that look like for somebody who is not vaccinated? So like a spouse to spouse. One spouse is vaccinated, but the other is not.
Yeah. It's theoretically possible, but I think, and this is why we recommend people that are vaccinated still wear masks in public and so forth. The issue is we're pretty sure, like we all know that once you get vaccinated, you're not only less likely to get sick, but you're less likely to carry asymptomatic disease. The question is, the problem is we just don't know how much. It's probably a lot, but we don't really know because that hasn't been completely measured yet. Like if you're talking about people that live together, this is kind of why we recommend people that are vaccinated still take some precautions to protect. It's not so much about protecting yourself. It's about protecting people around you and the unvaccinated people around you, because we just don't know exactly how much protection you got.
Thank you for that. So, Dr. Wimberly, we talked a little bit about this on Monday. but there are still lots of questions. Well, if I'm fully vaccinated, if you will, then why do I have to wear my mask? And if I have to wear a mask, can I reduce some of the standards of not double masking, but now can I wear things like gaiters instead? Those kinds of things. Can I just lose the mask?
You know, I think the CDC is going to address that issue soon. I think a lot of people have that same question because if you are fully vaccinated, there should be some precautions that definitely you have to continue with, but there should be some protection that you have as well. So I would definitely say to look forward to what that will be. Hopefully there will be something coming out in the next week or so that will give us guidance as to what that looks like in people who are fully vaccinated. The concern that really comes about, and I'll tell you, I do it all the time. Now I walk in a room and I say, okay, who in the room is vaccinated, who's not vaccinated? I still have my mask and everything on, but it's just more of a conscious thing for me, because what I will do is if a lot of times if everyone in the room is vaccinated, I do realize that sometimes people do have more of a kind of, I don't know, a deep sigh, you know, because we know that our risk is lower. So hopefully the CDC will come out with some guidance on what in particular needs to be done. I think at this point in time, we're really just still trying to get the numbers down, fight the virus. So having everybody do the same thing, honestly, is quite easier than if I see somebody with a mask off. Does that mean they're vaccinated, or does that mean that they just don't want to wear a mask? You know, and so I think at this point in time, to discern what that is. So right now, I do agree with the CDC right now in the sense that we just really need to keep the course of what we're doing until we get the numbers down.
Thank you.
I just do want to say that CDC did release something recently about like when you can take a mask off, and they basically say if you're in a room with other people and everybody's been vaccinated, fully vaccinated, so that means 2 doses of one or one of Johnson & Johnson, and it's been 2 weeks, then you can take your mask off. And they say that it's also safe for vaccinated people to be around like family gatherings and so forth. But they do still recommend, though, that if you're fully vaccinated, that if you're out in public, that you still wear a mask. And that is because you don't know the vaccination status or the health status of everybody around you. We're not 100% sure, like I was saying, about how much protection it gives you against, asymptomatic transmission. And, the masks do protect you, but the real thing is my mask protects you, your mask protects me. And so, when you're wearing a mask, you're saying you respect people around you and you don't want to make them sick.
Yes, thank you for that. Because right now, Fulton County employees, our standard and our policy is still that everybody is masking up, regardless of the status of your vaccination status. We are still, the expectation in Fulton County school system is that we all wear masks, and we wear masks appropriately. We know we've seen those that have it hanging off the ear, hanging on their name badges, but we want it around your face, around your nose, and your mouth. That is still the standard in Fulton County school system as it stands. So just a little bit more about some technical questions. So I've already had the vaccine. Should I postpone my upcoming mammogram? And I think this question came about, Dr. Wimberly, because on Monday we talked about, there was some discussion about maybe the vaccine showing some lymph nodes, or what it does to lymph nodes. So can you address that a little bit further?
With that one, I actually, I think that there wasn't a contraindication now that you've had the vaccine to getting a mammogram. I think the question is going to be, did you have any lymph node enlargement? And so if lymph node enlargement did happen as a side effect of getting the vaccine, then you should definitely wait till those lymph nodes are back down to your normal size so that it will not be misconstrued when you go to get your mammogram. I think that was the whole piece behind that, was those axillary lymph nodes becoming inflamed and going to get a mammogram and mistaking that as some type of a breast disease process that's going on. So I would say that to that person. And if that person has any more questions, they should definitely go to their doc to, let them know, hey, I got the vaccine. They can do an exam, look at the lymph nodes, and really give them a personal answer as to whether or not they should or not. It wasn't an absolute type of thing. I think it was just more of a cautionary tale to just think about that as you move forward.
Okay, great. Thank you. So the next question is, if I've already had the vaccine, and we've talked a little bit about this already, but just this question again is in the chat and keeps coming up. If I've had COVID before, now that I don't have to wait, if I had COVID in December, is it okay for me to get the vaccine now in March?
Yes.
Or do I have antibodies in my system?
Yes to both.
Yes. So again, for that answer to that question, I hope everybody heard Dr. Holland. If you've had COVID in December, in January, it is still recommended that you get the vaccine. And if you have questions about recently, and both of our physicians addressed that question, even as recently as a couple of weeks ago, that's something that you can certainly talk with your medical provider, because you, again, may be very much so eligible for the vaccine. Little bit more questions on specific considerations. So if I've had cancer, so you address the autoimmune issues, but what about things like if I have heart conditions, if I have cancer, are there any medical conditions that you feel would preclude me, or you feel are not conditions that would that I should take notice of not having the vaccine? I should say it that way.
Those are all actually reasons to get the vaccine.
Yeah, at this time, there are no medical conditions that have been set as contraindications to receiving it. So, nope.
The only two actual contraindications. The one absolute contraindication is a severe allergic reaction to the vaccine. So if you get the first dose and have one of those reactions and don't get the second dose, or an allergic reaction to any of the components of the vaccine, and the only thing that's in the vaccine that might cross-react with something is a compound that is similar to bowel prep solution that you get for your colonoscopy. And we did have one patient. I didn't think this was a thing, but it's actually a thing. We did have one patient that had an allergic reaction to his bowel prep solution. So we did not give him the vaccine and I advised him to wait for the Johnson & Johnson to come out. But other than that, there's no absolute other absolute contraindication. The only other relative contraindication is if you have had COVID and received the monoclonal antibody treatment, we ask you to wait 90 days for that. But that's not just people that have had COVID, but people that had COVID and received the antibody treatment for it, which is unfortunately not a lot of people. So if you had that treatment, and you'd know it because it's like you have to go to an infusion center and get an infusion for an hour of stuff. So if you got that, then we ask you to wait 90 days until after that. And again, that's not a safety thing. It's just a vaccine, efficacy thing.
So expanding on a little bit, or expounding on the healthcare conditions, what about medications? So there was a specific question that was asked, what if I am on high blood pressure medication or some of the other medications for heart conditions? Are there any medications that are contraindicated?
No.
Okay, awesome. Now this question has to do with herd immunity. And we talked a little bit about herd immunity on Monday, But the question asked, and I'm going to read it just like it was presented. What are y'all's projection for safe herd immunity in the state of Georgia?
Oh, God.
Mm-hmm.
I mean, I'm thinking the herd immunity is it's 70% is what it is the minimum level for it. And I think there is, and Dr. Holland, you may know, but Carlos Del Rio, we were on a talk together. Was that Friday, Lynn, that Dr. Del Rio put, there is a tracker online that
Yes,
you
ma'am.
put the information in. I don't know if you've seen this, Dr. Holland, but there's a tracker online that you can put the information in, and it tells you when you are projected to reach herd immunity in your particular area.
Mm-hmm.
So, the number that has been provided through the data and the studies is 70%. I'm not sure what we're at in Georgia now. What are we at in Georgia now, Dr. Holland? About 60%?
Oh, yeah, not very much.
Yeah, so I think we have a while to go for that, but the magical number that has been put out there is 70% at least for herd immunity.
But that's a herd immunity or whatever, that's a thing. But I don't want to, make it sound like, oh God, we're like far from being able to like have the vaccine starts to show effects early on. And the thing is, we did a really good job of vaccinating people in nursing homes, for example. And so if we, start there and like we vaccinate our seniors and, people with medical conditions that predispose them to severe disease. I mean, these are why these people were prioritized. As we get these people vaccinated, then, hospitalizations go down and death rates go down. And this is very important. So, herd immunity is like, that's going to be interesting when we get there, but we're going to see benefits long before that happens.
Thank you for that. So this question, and I know we only have 4 minutes left, so I'm going to squeeze these last 2 questions in because I do want to give you both an opportunity to kind of give some closing remarks based on some of the questions that were answered, that were asked and answered. So this question has to do, again, a little bit more about the vaccine and what it means to be fully vaccinated. And if I'm fully vaccinated, what does that mean? And what's my time frame that I can go and say I'm fully vaccinated?
Well, the CDC defines it as you've either received both doses of Pfizer or both doses of Moderna, or you've received 1 dose of Johnson & Johnson and 2 weeks have passed. So 2 weeks after your second dose of Pfizer and Moderna, or 2 weeks after your J&J dose, and you're good. You're considered fully vaccinated.
Awesome, thank you. So with that being said, we have actually answered every question from Monday and all of the questions that were presented tonight in through our live event chat channel. So with that being said, it's perfect timing because Dr. Wimberly, I'll send it to you first and then Dr. Holland about any closing remarks and thoughts that you've had and based on the questions and just things that you feel like Fulton County staff, teachers, and administrators need to know.
Oh, thank you. Yes, I just like to say that, there have been lots of questions, lots of very good questions from people about the vaccine and just the benefits of it, and also some of the side effect profile, and just what are some of the reasons to get the vaccine. And what I'd like to leave you with is, for me, the reason that I wanted to get the vaccine was because, working at Grady and at Hugh Spalding, seeing how this virus has really affected people in my community, people that I see on a daily basis, also people in my family and my friends. That has to me been one of the things that has really made me a strong proponent of getting the vaccine. And ensuring that others get the education that they need to be able to get the vaccine. I do want to reiterate something that I loved what Dr. Manning said on Monday about this, and said that there are two evils. COVID-19, you may think of it as two evils, COVID-19, and then you also have the vaccine, depending on how you feel about it, okay? On people who are deliberating. Instead of hesitancy, deliberation. You have to be able to choose between those two, which one that you want to take a chance on. Because at some point in time, you're going to have to make a choice. And right now, looking at all of the folks who have been vaccinated in clinical trials, as well as the folks who've been vaccinated since the clinical trials have ended and it's gone out to market, we have not, as Dr. Holland told you, we have not seen locally any type of severe allergic reactions or bad side effects to this vaccine. We just have not, and we have looked. Okay, we have really looked for it, because people are looking for a reason to say that this is not going to work. And so what I would really, really ask of you all is just to really think about the fact that getting the vaccine protects you, but it also protects others around you. It protects your loved ones. So even if you say, I don't need it, I'm healthy, I'm 26, I'm 30, I don't have any medical conditions, you're going to go visit your family. You're going to go visit your loved ones. You're going to be around other people. And so just think about it for that in that instance as well. And so continue to ask your questions, continue to do things, but I also implore you to really act too. Don't wait too long, because every one of your questions is probably never, ever going to be answered. One question leads to another, to another, to another. And at some particular point in time, you have to make a decision. And I don't want that decision to be made for you if you were to contract the disease. And so just think about that, and think about that seriously, because we are really in the middle of a pandemic and really fighting for our survival. But thank you for taking time this afternoon, for listening to us, and definitely welcome any other questions. Hopefully this has been helpful for you.
And the only thing I will add is today, actually, I realized is the 3-month anniversary from the day that I opened our first box of vaccine at Fulton County. And actually the day that I got mine, I was actually not the first person to do it. It was actually the health director, Dr. Paxton. She got hers first that day. But I was so excited about this, because it was like, you know, all this worry and stress and everything that, you know, my colleagues and I and the staff at the Board of Health have been through for that past 9 months, was like it was all ending. And you know, there's a reason that we were excited about it, is because they are safe. And if there's any question that I can answer or anything I can tell you that will make you feel safer, I'm happy to do it. And honestly, I recognize for many of you, I'm not the face or the voice that you need to hear that from, and I'm okay with that. But, you know, Dr. Wimberly and Dr. Manning and others, you know, there's some other people that can also give you those answers. So I, you know, just want to state that explicitly. So either way, you know, there's information out there. There are answers to these questions, and we are happy to give them to you.
You're on mute, Lynn.
Yeah. Okay.
My apologies. So I just want to, on behalf of Fulton County School System, I know we're out of time, but I just want to thank you on behalf of Fulton County School System for taking time out of your busy schedules to share with us this evening. Again, you all did an amazing job answering every question. So Fulton County staff, please remember, if you have not registered to participate in the Project vaccinate event, which starts on next Monday. Please do that right away. We have some exciting things that I want to show you just real quickly. The t-shirt that you will receive, you received a picture of it. We are super excited to have some giveaways, etc. So please register if you haven't already. I think I'll just leave us with this because we're out of time. I loved all of the closing comments from Dr. Holland and Dr. Wimberly. And as she said, I'll leave you all with what Dr. Del Rio said on Monday, which is nobody's safe until we all are safe. So we certainly encourage you to be informed, and hopefully these sessions have been informative, but to get the vaccine should you choose to do that. And Fulton County is making that available to you easily, very, very in an easy way. So thank you all. Have a great evening. And we look forward to seeing you hopefully on Monday at the vaccination event. Have a great evening, everybody.